Hi, good evening again from the New Orleans Summer Cancer Meeting here in New Orleans City, celebrating the 20-year anniversary of this CME CE event. Here with two of my colleagues from the GI space, with Dr. Tom Reske from Louisiana State University and Dr. Mike Cusnir from Mount Sinai, Miami, Florida. So I'm going to start with you, Mike. Give me at least 2 key points from your presentation that you just had in the GI section.
Yeah, I think that the most important is the data that we've seen of immunotherapy in the early stage colon cancer. That is the new standard of care for patients that are microsatellite unstable. And then the other one that is super important is that minimal residual disease monitoring also remains quite important in the patients with colorectal cancer, as mostly we can avoid giving chemotherapy to patients that are minimal residual disease negative after surgery.
Very good. Tom, your key points from your presentation?
Key points, most important is in the neoadjuvant setting for gastric adeno is the addition of durvalumab in neoadjuvant FLOT. That has been shown to have a significant overall survival benefit and should become the standard of care. The second one is in HER2 positive disease in gastric cancer, the Destiny 04 gastric trial. It showed a significant overall survival benefit in the second line with TDXD compared to ramucirumab and paclitaxel.
Good. So, in your field, okay, what are you looking to see in the next year or close to come, to the clinical practice for both of you? The same questions.
So also the monitoring with next generation sequencing, that we saw that there was a benefit with aspirin given adjuvant on the patients. We think that further targets like BRAF in early stage, it's probably going to move also with encorafenib maybe given adjuvant. So that data is ongoing. A phase 2 trial has been completed, phase 3 trial ongoing, and that's what we're looking forward to, all the next generation sequencing and using all the other targets early on.
Good. Tom?
Definitely BiTEs and ADCs. There will be more trials and results coming out.
Good. So, we really appreciate that both of you came to New Orleans.
Thank you.
Looking forward to see you next year. Next year it will be July 17, 18, and 19 in 2026 here in the Roosevelt Hotel. Thank you.